The following segment is sponsored by Adapt Immune. July is Sarcoma Awareness Month, the perfect time to raise awareness for this devastating cancer affecting young adults. Joining us now is Dr. John Carlson and his patient Megan to help educate us on early diagnosis and how to find a treatment center. Welcome to the show. So, doctor, what is synovial sarcoma and what are the most common symptoms?
Sarcomas in general are cancers that arise from soft tissues like muscle or fat or from bone, other soft tissues as well. And synovial sarcoma is one subtype of sarcoma that tends to arise in younger adults, like you pointed out, or maybe even older pediatric patients. Tends to arise in the extremities, but can arise anywhere in the body. It's a cancer that can be cured if caught early enough and with the right treatment. But the treatment may involve, really big invasive surgeries, may involve chemotherapy and radiation therapy, all of which can leave patients with side effects in the years after that. And like many cancers, even when treated successfully, patients are left with the worry that the cancer could recur.
In my experience, it took me over 5 years to get that diagnosis. I started experiencing shoulder pain as young as, middle school years, and I first saw a doctor for this shoulder pain when I was 15. I spent over 5 years getting physical therapy done, having x-rays, seeing different doctors, but unfortunately, a scan like an x-ray does not show synovial sarcoma due to the fact that it's a soft tissue sarcoma. So it took a more expansive scan, such as an MRI, which for me, it didn't happen until I had a physical therapist, advocating with me at a doctor's appointment, insisting that I needed an additional scan. So, while typically people don't go over 5 years, that long to get this diagnosis. It's not extremely uncommon for sarcoma patients to struggle with that diagnosis time just because so many of us are young, otherwise healthy individuals, and it's not instinctual for a doctor to find out you have a shoulder pain and then assume that you have cancer, right?
Sorry, I was just going to add, I think Megan's experience highlights some important facts. Shoulder pain, other pain, lumps and bumps that you can feel, those are mostly not going to be cancer, most often not going to be cancer. But if the pain is persisting and unexplained, if a lump is growing and becoming painful, those are red flags that should clue us doctors into looking a little deeper into what's going on. The surgeries are specialized often and require orthopedic oncologists or surgical oncologists that have experience treating them. The chemotherapy protocols and radiation protocols are specialized, and we know that outcomes are better when people are treated at centers that have experience treating sarcoma.
First and foremost, questions about the treatment plan. What is it going to be? Why is it going to be that way? Making sure that your doctor understands, not only how to treat sarcoma, but how to treat your specific type of sarcoma. In addition to that, making sure you understand the side effects that you're in for. Cancer treatments can be incredibly harsh on people's bodies, and using your care team as a tool to try and assist with minimizing some of those side effects is completely reasonable for you to do. And also, what is the rest of your life going to look like following this treatment? What long-term side effects can you expect? What are the chances of recurrence, and how can you keep yourself healthy post-treatment? Those are all really important things to ask.
A couple websites to think about. One, the Sarcoma Foundation of America is a great website for patients, and it's curesarcoma.org. Specifically regarding synovial sarcoma, there's a website, flagsynovialsarcoma.com.